Okay, so welcome to this virtual workshop on Medical Laboratory Technician Program. I'm going to turn things over to the director of the program, Kat Mashkina, who will tell you about this exciting career. Okay, I'll mute myself, Kat.
Okay.
And I'll watch. The other thing I didn't mention, if you have any questions, you can put them in the chat and we'll look at them at the end, or we'll have time at the end to actually ask questions as well. Okay.
Okay, hello everyone. My name is Katarina Mashkina. Some people call me just Kat because my name is too long. So I will present you a short PowerPoint and explain you about the program, and then we can have some questions and answers. So I guess you see my little PowerPoint here. See if I can do a presenter view. Never works for me. You know what? I'm just gonna get. So what is medical laboratory technician profession? And what are those people doing with your body fluids? Many people don't even know what we do. They think that MLTs just draw blood and somebody else tests the blood, but really only 95% of the laboratories have their MLTs draw blood. Typically, that's the phlebotomist's job. So MLTs do actually test the blood and trying to figure out what is the disease here. I do want to show you just a short video of our laboratory so you can see. Okay, so share computer sound, share. You don't hear the sound, that's okay, it's just music. This is our lab and our lab here. We have a botany lab. We have a lot of equipment. It's hands-on, so we simulate the labs in field. And we help diagnose the situation according to their test results. The salary is actually more than that. I'll tell you. Current salaries and hourly rates. Okay, so back to my PowerPoint. Please let me know if you stop hearing me sometimes the sound.
Diagnosis is an important part of your medical journey, and that starts the medical
Oops.
laboratory.
Sorry about that. Okay, so the reason right now it is even the labor shortage right now is even higher because of all the COVID testing. I get emails and phone calls from the laboratories asking me to forward the jobs to our students and graduates because they have expanded their COVID testing and they don't have enough personnel to test it. But so this is the data from 2016 to 2026, we have expected employment growth 13%. So now obviously that was done before the COVID, so now it is definitely higher than that. It is nationwide shortage. Many states having a really hard time getting the MLTs or medtechs in because say nobody wants to live in that state, so they do offer even relocation bonuses and stuff like that. Some medical tech programs closed. That's not the reason. So Camden Community College closed their program last year. And the medical field is growing, obviously. So it is a really good time to get in this profession. It's, I believe, it's there with nursing on how many med techs we need right now. So did you know that about 70% of medical decisions are based on lab results? It's what the doctors looks at before even they look at the patient. So patient comes into the ER, right away they get blood drawn. According to their symptoms, they figure out what test, and then the doctor comes in. So we play a crucial role in the detection, diagnosis, and treatment of the diseases. It is kind of a mystery profession. Not everybody knows about it. We do work behind the scenes. Most of the time, there's no patient contact. And people don't even know how does this get tested. We do have analyzers. We do have some manual methods, but not everybody can do it, because it is a law to have certain education to be hired as a lab tech in a lab. I want to just show you some pictures. So we do start with the phlebotomy. We train students on the dummy arms to draw blood. It's basically pre-analytical stage, and it's important to go for this class, even that you might not have to draw blood ever again, but it is really good to know what errors can be made and how to watch out for them. Then we go over to real patients, which you are, as a student, going to be each other patients. And students basically get their first tube of blood on the second laboratory that we have. So that's our pre-analytical stage here. This is our students from a year ago doing phlebotomy. One is phlebotomist, one actually became MLT. They do spin the blood in the centrifuges. They need to know what needs to be spun or what not. Maybe something needs to put on ice. So there's all this information they need to know. Just after the phlebotomy, some students can just become lab professionals who work as phlebotomists while they go to school. And they can take a board exam from ACP. This is a national-wide known organization. So the analytical stage is those departments. So every lab has, most of the labs have all the departments. So it's clinical chemistry, blood banking, clinical microbiology, clinical immunology, clinical hematology, and coagulation. So all those departments are basically MLT course, separate MLT courses. And our students use laboratory instrumentation, lab computers, and perform complex lab tests on various types of human specimens. So that's blood, urine, typically some body fluids like pericardial, ascites, things like that. Most of the time it is just tubes of blood though. So after the program is over, which is 18 months, it starts in the fall typically, and so it's first year, fall, spring, and then summer, and then the second year is just fall and spring. So it's 5 semesters. The last semester is clinical practice. That's favorite part of all the students. They get to go to the clinical sites, rotate for all lab departments. They get hands-on practice and learn to be part of the team and practice everything they learned. They basically have to come prepared. That's why we teach all this stuff. Their clinical sites expected them to know most of the things. So they just come to practice. And because they're so well prepared, they're so easy to train them. And because they already have trained, many students get hired at that clinical site because it's they basically already med techs, and they just take them on another little training and they can go work. So basically test drive the student. If they like the student, they hire them. After the program, students, graduates can take MLT ACP exam, which is not mandatory to work as a med tech, but because it is required by most of the laboratories, we do suggest the students do take it. But by law, you do have to pass MLT program to start working in the laboratory. But the exam is not necessary, but somebody who doesn't take it, maybe they get hired, but then they switch the jobs and then they realize they can't get that second job because it requires ACP, and they, at this point, it's too late to take the exam. You do have only 5 years to take it. And plus you must probably forgot most of it. So it is a good idea to take certification and put those credentials next to your name. Some other part of our labs is clinical chemistry. This is student checking our mind rate analyzers. It does basically the chemistry panel, your glucose, your BUN, creatinine, most of the things the doctor orders. The red tab goes there. If you wonder why do you get so many different color tubes when you go to the doctor, that's why. Every tube goes to a different instrument. They use the top portion, which is called serum. The students pipetting things into cuvette to measure and spectrophotometer. That's a manual method to do this. It was glucose. So they practice a lot of pipetting, dilutions to run those spectrophotometers, which is part of that big instrument, but we want them to know both because pipetting is really important too in the laboratory. They do some more complex testing like electrophoresis. So they run serum specimen through the gel and then they have bands appearing, and that can diagnose multiple myeloma, sickle cell disease, and some other diseases. The hematology lab have mini hematology instruments. So it's one tube at a time versus in the laboratory, you have a big machine that does many tubes at the same time. So it tests for red blood cell count, white blood cell count, platelets, hemoglobin. So we can diagnose anemia, blood, and cancers. We do as students if they want their blood tested, so they draw each other and test their own blood. So so it becomes more interesting for them. This is the lavender tube. That's what we use for hematology. We use whole blood. So we mix it up and make a smear if the analyzer flag it for some kind of abnormality, say white count was high. So we stain it then and look at the microscope. And this is how our red cells and white cells look. It's normal. This is like a cluster of cancer cells. So our MLTs could be first to diagnose cancers in patients. So that's exciting. So that's why they need to know different cells and how they look like. So she's looking at the microscope, and if she's doing a differential, she will count the cells, the percentage, how many white cells of different kinds is there. Because that will really depend, like say somebody have bacterial infection, they will have more neutrophil, which is this cell here. If somebody has allergic reaction parasitic, they have eosinophils, which is this. And if they have some kind of infectious mononucleosis, they have a lot of lymphocytes, which is not shown here, but it's a little blue cell. So we have coagulation analyzer called STAGO, and it measures clotting time. This is to monitor anticoagulant therapy or to see if somebody has a clot. Somebody has clot tendencies, but most of the time it's for people on blood thinners, and it's a blue top, and we use the top portion, which is plasma. And people, who had some kind of clotting episodes, put on Coumadin, aspirin, on things like that, and they need to be monitored. Then we have urine analysis lab. So a lot of things could be told from urine analysis. So you can tell about kidney function, urinary tract disorders, diabetes, obviously sugar is high, liver disorders, metabolic disorders, muscle trauma, hormonal disorders, and obviously the drug use. We also do microscopics on urine analysis. That's what you could see. This is yeast. Somebody with diabetes might have yeast infection. You can see parasites in urines. This is normal epithelial cells from, say, urethra. You can see some pretty crystals like calcium oxalate, uric acid, looks like flour sometime. You can even detect STD, this is trichomonas. This is stained one, but on the microscope it will be moving because it's got a flagella. So you'll see them moving, but they resemble white cells, so you gotta be careful not to miss those. Microbiology is really interesting too. It's not like a regular micro. We have clinical pathogens that we work with. She's looking at different smears. So when bacteria is plated on different media, it turns color, and then we can tell what it is. And this is the antibiotic susceptibility. So you put the antibiotic pill and see if the bacteria is susceptible or not. Some bacteria looks really pretty, like this one. It's bright orange. And then you can also do it manually, or you could do it on an instrument. This Vitek analyzer is really expensive, and most of the regular labs have it, and they're surprised that we were able to get it at the college. So you do the suspension of the bacteria, and it tells you what bacteria is and what antibiotics are, but you still need to know both methods. blood banking, really important course. So it is crucial to be really attentive to detail, because you type in blood for, its ABO and RH status, and then you find compatible blood. So if you're not doing correctly, the blood could be transfused of the wrong type, and the patient can die. So that's really important class to do really good at. And so we teach you how to do the testing and compatibility, and this is one of the department in the lab that is super important. Let's talk about career paths. So you can do a lot of things. Most of the grads work at hospital laboratories, some work at the outreach like Quest, LabCorp, things like that. Some end up working in physician offices, pharmaceutical companies who does like clinical drug trials, even at veterinary labs, but though they do pay a little less than clinical labs because of the insurance, right? Fertility clinics do require further education. And what's best about it, it doesn't need patient contact. So if you're one of those people that wanted to be in clinical field but don't want patient contact, you're not really excited about seeing wounds and taking care of the patients that are really sick. Maybe you feel sad when somebody's really sick. Maybe that's be a good path for you. So other students just take this to get into medical school or PA school, a physician assistant. There's also a pathology assistant you could do. So many students do transfer to four-year institution and continue on. And you can also get a four-year degree in MLS, which is you're going to be a higher rank technologist. And then if you get a master's, you can be a supervisor or you can teach. Or you can go back to research or any other field. Some people go back to nursing, but while working as an MLT, so it helps with the money issue. So salary report, it is 51. I should really change it to 60 because right now I have did the survey of the student that just graduated. All of them have jobs. There was 18 of them. Some of them reported high salaries, $28 to $35 an hour right now. That's for brand new MLTs. So, I mean, obviously there's some hospitals that only pay 25, but I see it's around $30 an hour right now. And plus the differential evenings pays a couple $1 more, third shift pays even more. So you can make up to $65,000 working as MLT, which is not bad with just an associate degree. And per diem obviously pays more because they don't have health insurance, so per diem rates could be even higher. And many students who want more money, they end up working full-time and a per diem somewhere, or part-time and two part-time jobs to fill their schedule up in 2 different places. That also can be done. Then you can make even more money. So let's talk about admission. It is selective. The minimum point GPA is 2.25, but it's really rare that we do admit such a low GPA. It's usually around 3. We've been having a pool of students that have higher GPA. So at least above 2.7 was kind of like the lowest one last year. And obviously, I mean, if you can explain your low GPA to us, we could work with that. So you need the high school biology or chemistry or college equivalent. So there's biology 108 and chemistry 110. It is better if you do have the college ones. So if you did well on that, that also tells us that you like science. Applicants must demonstrate readiness for English 101 and FMT 118, but again, it's better if you did already take it. You would need to fill out a health form to prove that you are immune to all the bloodborne pathogens. You need to have health insurance throughout the program, especially for clinical courses. And then you would be asked to obtain criminal record check, child abuse clearance, and drug screening prior entry into the program. And this is the same for all allied health programs. Same as you do have to take Kaplan test and pass it. It is going to be open enrollment starting October 1st. So you can send your applications. I'll show you where to do. I'll show you the site with the link, but I can also send you the flyer with the link. Usually, so this time we started in the spring. This year is fall. So next year we'll hope to start with the fall with the phlebotomy course. Spring is hematology, summer blood bank. Fall we'll have 2 courses, clinical chemistry, microbiology. This second year, it becomes hard to work at the same time. And last semester, spring is clinical practice, basically 5 days a week. That's pretty hard to work as well. And you'd graduate in May. So it's basically 18 months. There is a link here for the catalog. And then you apply for graduation in associate and applied science as in MLT. You need 63 credit hours, and you have to keep your GPA 2, and you can have any Ds in all the required courses. This is our picture from like 2 years ago. Graduates, those are the scraps you'll be wearing at the clinical site. This is Lynn, and this is me. There's only 2 of us, and plus the lab assistant. That's why the course is only offered once a year. We do have diverse group of students all the time. We do have some guys. How many we had? 1, 2, 3, usually 3, 4, or 5 guys. So this is our favorite cartoon hero, basically saying without lab, you're only guessing. And before I take questions, I want to share the website. Hold on. So we have our MLT page. We have, a photo gallery. We have student handbook. You can see what clinical sites we have. We also have a page that usually I post here info events, and then if you click apply, it will tell you what the intake process is. And so intake process now is online. You would send your application that you can download here to Tanika. That's her email. And then she will schedule you for Kaplan exam, but you do have to have all the prerequisites. Okay, I guess we can stop recording.